My name is Chewe Luo. I actually come from Zambia. I'm working for UNICEF in New York as the Senior Program Advisor for HIV/AIDS.
At UNICEF, what is the main target that you are working with regarding HIV/AIDS?
UNICEF has 4 areas of focus. We work on prevention of mother-to-child transmission. We work on pediatric HIV care and treatment. We work on the social determinants of the epidemic, but also very much looking at what would help us in terms of the addressing social norms and some of the financing issues to make sure that we maximize what we're trying to do. But we also work on prevention, especially targeting adolescents.
From your perspective, the UNICEF perspective, listening to the talk about ending AIDS, what do you think about this?
This is an exciting moment for us. We've been working on prevention of mother-to-child transmission, for instance, as far back as 1999. And this was at a time when we only had very little information. The first publication on this issue was actually called the PSCTG 076. That study, which was basically an AZT-based regimen administered to women, demonstrated a 67% reduction in transmission risk. But looking at that regimen at that time, it was very, very complicated. The idea that you had to give drugs intravenously during labor was very difficult for us as an organization. But the studies that followed after that actually looked at simplified platforms. And as far back as 1999, UNICEF actually initiated some of the initial programs in about 11 countries to look at feasibility of integrating these interventions in maternal child health programs.
If you look from 1999 and what you described, what are the milestones in this regard?
Well, the science has grown. That's the first thing. The second thing is that countries have actually been trying very hard to see how best to implement these programs. We have a lot of experience from programs themselves. And what we have today is really a combination of the political will, the science, and the donor community actually saying we can support this because we know it works. And I think the proclamation now that we can get down to 0, so the global plan to eliminate mother-to-child transmission is what's driving the energy and the effort that UNICEF is engaged in.
You have a goal to try to eliminate it until 2015, if I understand right.
That's right.
What is from now to 2015 important steps?
Very important that we look at what we've done and look at what lessons we've learned. But more important is to look at how we can simplify approaches, simplifying the regimen choice, simplifying the programming approaches, simplifying how we adequately engage with communities. And the cornerstone of this is actually to make sure that these programs become available at the lowest level of care, so that the majority of women that are not able to go to specialized hospitals can actually access.
Are you optimistic?
Very optimistic. The new statistics that have been released at this conference indicate that 57% of women are actually accessing this intervention. We can do better, we can accelerate, and if we do the few things that I spelled out, simplifying the regimen approaches, simplifying how the program is actually implemented so that the lowest unit of care can actually implement, making sure that there's adequate linkage with community action and support, I think we can get there by 2015.
And what will happen then in 2015?
What will happen in 2015 is that we will have a world without HIV in children. But the important thing is to make sure that we develop the type of partnerships with governments, with the donor community, so that we sustain the gains that we would have achieved.
If you look, there are many orphans, victims to the AIDS epidemic. What can be done to help and facilitate lives for the orphans?
I've just reviewed the data on this, fortunately. One of the things that the PMTCT program and the ART program actually needs to do is to make sure that the program actually adequately addresses the need for women to access treatment. the pregnant women, the women who are breastfeeding, accessing treatment so that we keep them well and alive. That's what's going to sustain the orphaning program. Today, when we look at the data, double orphaning continues to increase, even in those countries that are doing very well with PMTCT. And I think one of the issues is the fact that programs are not adequately identifying those women that need treatment. So we need to do that first. But in terms of what we need to do for orphans and households that are affected by HIV, one of the critical elements to this is what we're calling social protection. How do we identify those vulnerable households that need additional support? And then second to that is then how do we actually deliver that support? And we're working with a lot of national governments to make sure that they do put in place some mechanisms, social schemes that can adequately support these households.
When you are working to come to this goal, do you think that still stigma and discrimination is an obstacle?
Yes, very much so. A lot of women are not disclosing their status, even to their partners, because they're worried about discrimination and stigma and violence, actually, to them by their partners, their families, and communities. And one of the things we need to do better is to work much more closely with women living with HIV, those associations, so that they can put structures in place that can adequately support these women.
When it comes to adolescents, what is the most important to do there?
The adolescent program, I call it, and I will talk about it tomorrow, I call it the unfinished agenda, because a lot of new infections are happening in this age group. When you look at the adolescent age group, you have two types of adolescents. You have those adolescents that would have acquired infection from their mothers who have survived to adolescence. That makes up very little of the infections in the adolescent age group. If anything, in most countries, high prevalence is about 2 to 3%. But when you look at the adolescent infections overall and what's happening to that, a lot of the new infections are actually happening in adolescence itself. And we need to do a better job to make sure that adolescents, first of all, know their status. The second is that they have access to high impact interventions to reduce not vulnerability but risk.
Now we have a world economic crisis. Are you afraid of scaling down of the funding to do this?
Yes, and I think this is what most people will be talking about at this conference. But the idea that we have achieved so much should give us the energy and the impetus to start looking at innovative financing mechanisms, working together with governments to look at how health in general can be financed and what are those sort of innovative approaches that we can apply to make sure that we don't dry out on the resources that we need.
What is your message, your personal message at this conference?
My message is that we can do it, and collectively we can.